All right, it's still Good Morning Nigeria on the network service of the NTA. And to begin our conversation on zoonotic diseases and its prevalence, here is a background report put together by our correspondent Ibrahim Dan Hamidou.
Zoonotic diseases are illnesses transmitted from animals to humans. They can be caused by bacteria, viruses, parasites, or fungi and spread through direct contact, contaminated food and water, or vector-borne transmission. Examples include monkeypox, Ebola, rabies, and Lassa fever, which is common in West Africa, including Nigeria. Nigeria is experiencing a surge in zoonotic diseases, with a 63% increase in outbreaks reported by the World Health Organization. Monkeypox cases are on the rise, along with other concerning diseases like Ebola, dengue fever, anthrax, and plague. Factors contributing to this increase include population growth, urbanization, improved transportation, and increased demand for animal-derived food. The World Health Organization and other United Nations agencies are working together with the National Center for Disease Control in Nigeria to address this growing concern. They are implementing the One Health approach, which recognizes the interconnectedness of human, animal, and environmental health. This approach aims to strengthen health systems and enhance preparedness to tackle zoonotic diseases. Communities across Nigeria are grappling with the implications of these diseases, which not only endanger human health, but also disrupt livelihoods and economic stability. The need for comprehensive strategies to address the root causes of these outbreaks has never been more urgent. Guests on Good Morning Nigeria will discuss how the nation confronts these challenges and prioritizes measures that promote coexistence with wildlife while ensuring the well-being of all citizens.
All right, thank you very much, Ibrahim Hamidou, for that background report. And joining us for the conversation on zoonotic diseases is Professor Lawrence Ogbonnaya, President, Epidemiological Society of Nigeria, EPISN. It's a pleasure to welcome you to Good Morning Nigeria.
Thank you very much. Good morning, Nigeria.
All right, and we have also been joined here in the studio by Dr. Mohammed Shakir Balogu, Resident Advisor, African Field Epidemiology Network, AFENET. Thank you for joining us.
Thank you. All right, Prof and Doctor, thank you so much. I'd like to begin with Professor Ogbonnaya. Could you explain to us what really are zoonotic diseases, and then what kind of diseases fall within the scope, this zoonotic disease cap?
Yeah, thank you very much. Zoonotic diseases are the diseases that primarily occur in animals, but they can be transmitted to humans. And that transmission can come from various means. For some, a disease like Lassa fever, that is currently ravaging the nation now, it can come either from eating the rodent hosts, the multi-mammat rats, or the rat will contaminate human food, either by its blood or urine, or when a human being has already been infected and is diseased, that human being will now transmit it from one person to the other. So basically, it comes from animals and then enters the human population. That's what a zoonotic disease is. A disease like rabies is the host is such animals like dogs. When a rabid dog bites a human being, it can be transmitted. Or in those communities that eat dogs, they can also get it from eating improperly cooked meat. A disease like what we call bovine tuberculosis, that's the TB that occurs in cattle. When man eats improperly processed cattle meat, we can also get tuberculosis. So zoonotic diseases are principally diseases that occur in animals, but they can find their way into the human population.
Are there classes of these diseases? When you talk about zoonotic diseases, do they have classes? What are they?
Well, zoonotic diseases could be, they are majorly viral diseases, but they can be bacterial. HIV, for instance, originally started from a breed of monkeys and then entered into human beings. It's a viral disease. Ebola viral disease is a viral disease. Again, started from a breed of bats and entered into human population. Lassa fever is called Lassa fever virus. Again, it's a viral disease. Bovine tuberculosis is a bacterial disease caused by Mycobacterium tuberculosis that attacks animals, but it can find its way into the human population. So they belong to the various classes of microorganisms.
All right, Dr. Shakur, I would like you to pick up from where Professor Gwanaya stopped. He's made us to understand what zoonotic diseases are. Could you speak to us about the level of awareness about these diseases, and then what actions of man, cause it to thrive?
Yeah, sure. So, zoonotic diseases in recent times, I think the level of awareness has increased. So people are beginning to understand that a lot of infections that we have in the human population actually come from animals. In fact, 60% of all existing human infections are of animal origin, and about 75%, that's 3 out of every 4, new diseases that we encounter in the human population are actually from animals. So when you talk about COVID, you talk about avian influenza, you talk about swine influenza, you talk about Lassa fever. So a lot of the new diseases are due to epidemics, particularly from animals, and people are getting aware of that. The world is becoming more, but I think we still need to raise the level of awareness, how people can, protect themselves from having these diseases. Very simple methods, things like hand washing. People need to understand that there are animals everywhere, on the farms. Some people work with animals on a daily basis, with dogs and horses. And by touching them directly, you can have it. And sometimes even touching things that we have contaminated. So coming in contact with their saliva, blood, urine, feces, mucus, all those things can lead to transmission. But one of the most important ways to protect yourself is hand washing, as simple as it is. When you've been in contact with animals, or you've been in a place where animals live, maybe washing out the coop, the chicken coop, or the kennel of the dogs and so on. And even when you have not touched anything, once you've been in the environment, please wash your hands with soap and water. And if that's not available, use alcohol as sanitizer that has up to 60% alcohol. So people need to know that diseases can be easily transmitted from animals to humans. And the tricky thing about some of these diseases is that the animals don't necessarily show anything. Most of the time they are just normal. And when the virus or the bacterium crosses from the animal to the human, it causes a disease. It's pathogenic. So we need to be aware of all these things.
All right, thank you very much, Dr. Balogun. Let me quickly get back to Professor Gwanaya. You alluded earlier to zoonotic diseases ravaging the country. And I wanted to find out what's the situation with those diseases in the country as we speak. And what's the fatality rate?
Well, for Lassa fever, which is the most topical, as at the week 6, which was in February of 2024, there was a total of 2,122 cases of Lassa fever in 21 states of the country across 78 local government areas. As at today, the number has increased much more than that. As at that week 6 epidemic report, the case fatality rate was 17.5% of confirmed cases. So it is a serious problem. COVID, as frightening as it was, as much as it shut down virtually the globe, had a case fatality rate of less than 3%. Less than 3%. The Lassa fever has case fatality rate currently in the country of 17.5%. So if you compare it with COVID, let's say 100 people get infected with COVID, it just means about less than 3% will die. But if 100 people get infected with Lassa fever, 18 will die. That is that serious, irrespective of the chronic sequelae, the consequences that follows even when somebody recovers. Many people have recovered from Lassa fever, they had complications in their renal functions and in other organs of the body. So it's a serious matter. For rabies, there is a 100% fatality rate. If somebody has rabies, that person will die. That is why for us as epidemiologists, one case of rabies is an epidemic. You know, and all other of these zoonotic diseases have varied severities and case fatality rates.
All right, Prof, thank you so much. Doctor, I'd like to get back to you, Dr. Shakur. I asked you earlier about the activities of man that helps zoonotic diseases to thrive. You talked about touching animals. You didn't talk about eating animals, because we know that some of these zoonotic diseases, are caused as a result of feeding on some of these animals. So I want you to speak around that, and then also tell us what is the strength of diagnosis and detection of zoonotic diseases in the country.
Yeah. So let's get back to the basics. So like I've said, transmission occurs when we come in contact with the feces, blood, saliva, or mucus from those animals. So there are different situations or different scenarios that can lead to this. Sometimes even vegetables that are not properly washed, that have been contaminated with feces of these animals, can lead to transmission of zoonotic diseases. Then you have milk that has not been pasteurized, it's not been boiled. It can also lead to transmission. Then you have other means, like when people kill these animals, there are so many opportunities. Sometimes when you capture an animal, it's frightened, it urinates. In that process, it can discharge a lot of viruses in the urine. Then when you're processing the blood itself, you can get it directly, and improperly cooked meat also can lead to it. So there are so many scenarios or many opportunities for this to happen. And so touching is what is most obvious, most of the time. When people pet animals, when they kiss animals, something can happen. So, and that's why for a lot of veterinarians, veterinary epidemiologists, they talk about vaccinating animals. In many countries, you can't keep a pet without having them vaccinated for the common illnesses, particularly rabies, that can be transmitted. So there are scientifically proven methods for, breaking the chain of transmission from animals to humans. But at the end of the day, because of the large number of contacts that people have, hand washing is very, very critical. We have, if you're not a butcher or you're not involved in processing meat, you hardly ever come in contact with the blood. Most of the time is touch, and that's a major means. And people also forget that sometimes when they leave their feces behind, the feces can still have the viruses survive for a long period. So you can still have it. And sometimes, in fact, there's something called aerosol, where feces, saliva, and things coming out of these animals become suspended in the air. And if you breathe them in, you can still have the infection. So one has to be very careful when you're in contact with animals, whether at home, at work, or on the farm. So all these things are very important. So not assume that we are safe with animals. We are not safe with humans. We get disease from humans every day.
Let alone animals.
Yes, let alone animals. And a lot of new diseases emerge from animals.
So from what you're saying, you're discouraging keeping pets?
We're not discouraging keeping pets. We are saying there are precautions that can be taken. So that's why we get to talk about an approach that helps with controlling zoonotic diseases called One World, One Health, which comes out of the recognition that our health is closely connected to the health of animals and to the health of our shared environment. This thinking is very important. That's what we use in prevention and control, and I think it's something that should be mainstreamed. Everybody should understand that we are not safe as long as animals have diseases circulating, and we are not safe as long as our environments are contaminated. I'm sure you heard of what happened in Sokoto recently, where some people came down with an unknown disease because the soil and things around were contaminated with heavy metals, and children started having symptoms of a disease caused by heavy metal poisoning. So we have to change our thinking. We have to know that our health is tightly connected to the health of animals and also the health of the environment. We can have, and beyond the diseases, indirectly, there's something called food security. If animals get diseased, even if you don't get the disease directly from them, and they die in large numbers, it's going to affect the livelihood of humans, and the psychological implications of that, and issues with malnutrition. It's also going to affect food security. If animals die in large numbers, we lose a lot of source of protein and the rest of that. So we need to critically think, and that's why now doctors in the human health sector, doctors in the veterinary sector have to work together. That is what One Health is all about. We can't work in watertight compartments anymore. And he mentioned rabies and how fatal it can be. And rabies, almost 100% of the time we get them from the dogs, domestic dogs and dogs around. Of course, we can get from bats too, but that's rare. And for rabies, you can't control rabies in the human population if you have not controlled it in the animal population, because that's where the source is. So for us to be able to deal with rabies in humans, we have to vaccinate the dogs. Once we eliminate rabies in dogs, we won't have rabies in humans. So the health of the dogs is critical to our health as well.
Doctor, you made mention of the fact that we need these animals around. You talked about for food, of course, we need them for security,
for sports,
and a lot of sports and all, exactly.
So many things.
So that's why I asked about the strength of diagnosis and detection of these zoonotic diseases, because they will always be with us. So it's about being able to detect, diagnose it on time that saves the population. So
I agree with you. So we have a surveillance system in Nigeria called the Integrated Disease Surveillance and Response System, and it has something called case definitions. So case definitions are just criteria to say whether somebody has a disease or not. So if you want to know whether somebody has Lassa fever, does he have fever, and things like that. Once you see these symptoms, you want to take a sample and confirm in the lab. So we have labs that can confirm Lassa fever, yellow fever, and many of these, even dengue, many of the diseases that fall within the category of zoonotic diseases. So many of them can actually be diagnosed in Nigeria. And in the last 10 years, we've really, really expanded the laboratory capacity for that, not just in Abuja, but also outside. Like in many places where we have Lassa fever a lot, like in Edo State, Ebonyi, we have labs in places like that that detect, the test for Lassa fever all the time.
Are there still tests being carried out at points of entry into the country? Because, for example, in the case of Ebola, we know it was imported. So, do we still have regular checks at the point of entry, just so that if it's not homegrown zoonotic disease, those coming in from outside can also be checked on time?
Yeah, so strategies in public health are based on risk levels. So you have to do a risk assessment and see what is the risk of the importation of Ebola or Marburg or any disease at all at any particular point in time. If the risk is low, it will not be cost effective to put up a system to be testing people for that, because you will test millions without finding one case. But if the risk is high, let's say there's an outbreak in Benin Republic, or there's an outbreak in Cameroon, or some other faraway countries from which we receive a lot of passengers, let's say the UK or the US, then it now makes sense if there's an outbreak. But if there's no outbreak, it doesn't make sense to test for those things on a routine basis.
So what do you look out for if an individual has a zoonotic disease, for instance? What signs should you look out for if you don't have to go testing?
Yes. So the signs and symptoms of zoonotic diseases depend on the individual disease. So they present in many different ways. Some of like Ebola, for instance, will present with fever. You can have abdominal symptoms like vomiting, even diarrhea and the rest of that. Some other don't present with that. Some present more with jaundice. But one thing that tends to be common in most of them is fever. But fever is not specific. You have
Because
fever.
humans have fever.
Yes, so fever just means the body temperature is high. So we have that in malaria, we have that in typhoid, we have that in the wide variety of diseases. So it's not specific. So what we do most of the time is we assess the risk and the likelihood. So if somebody comes to you with fever in a place like Ebonyi or Irua, as you're thinking of malaria, you're also thinking of Lassa fever. But if somebody presents with fever in Sokoto, we are not likely to think of Lassa fever because it rarely occurs in that part of the country. So most of the time we use risk assessment. What is the most likely thing? Otherwise we'll waste resources, we'll test a lot without finding one case. And these tests are expensive, particularly for Lassa fever is a molecular test, PCR. Not every lab can do it and it's quite expensive. So it's based on a high index of suspicion.
All right. Thank you very much, Dr. Balogun. Now Professor Bonaya, rather. Now, we understand that the emerging zoonoses have economic consequences, as a global health challenge. Why is this so?
Well, in WHO circles, we, for instance, in international health, we want to control diseases without interfering with global transport. That's the maxim. That's the global best practice. But when diseases become pandemic, like we had in COVID last, it interferes with world commerce, with world traffic. And in that way, it seriously affects the economy, either of the nation or of the entire world.
Okay.
Yeah. So these zoonotic diseases, they don't recognize borders. Neither do they recognize tribe or sex. They just migrate. They don't need your visa to cross into your country. And when it occurs in such a level as we had in Ebola, as we had in COVID-19, as we have had in other diseases that, thank God, those ones have not reached our borders, it severely impacts on the economy. Number one, a healthy nation is a wealthy nation. So when many people are sick, productivity will go down. And like all of us witnessed during the time of COVID, it came to a point when the whole world agreed that the best way to immediately curtail the spread of COVID was shut down. So when you shut down, nothing happens. So that is why we must do everything possible at the preventive level. Because once it comes, it brings a lot of catastrophe.
Talking about prevention now, would you say that there's a lot of collaboration, or if you like, cooperation going on between public health professionals, veterinary, those in veterinary medicine, those in the wildlife sectors, just so that, we're able to deal with zoonotic diseases on time without affecting, the economic life of a nation?
My colleague had just talked about the One Health platform, championed by WHO and other stakeholders. We have now, everybody has realized that you can't do it on your own. Initially, there were, past years, there were some, I call it competition or rivalry amongst all these professionals, everybody, operating in silos. But it has become clear that if we must deal with these zoonotic diseases, we must come together. So there is this One Health platform which brings everybody together, veterinary epidemiologists, human epidemiologists, environmental epidemiologists together on the same platform, so that we can all bring our expertise together, we can all work together, we can all do things that will enhance the control of these diseases. He has just mentioned the fact that you cannot control human rabies without controlling rabies in dogs. So the human physicians must work with the veterinary physicians. It's not possible that we will be treating rabies in human beings without the veterinarians treating rabies in dogs. The same thing with COVID-19, like we said. Remember at the beginning, the pangolin bats were fingered and all of that. Earlier on, you asked about activities of man that causes this. Environmentalists must come to the table. If the economic activities going on in Zamfara, Sokoto are not brought under the purview of this One Health approach, they will keep contaminating our environment, and human beings will get it at the end of the spectrum. Yesterday, during one of our scientific sessions, somebody raised, in fact, a paper was presented in our scientific conference where fish in Kano has been found to be contaminated with a lot of heavy metals, and people are eating that fish and dying and developing some diseases. Investigations have been done and traced the industrial activities around the Chalawa River in Kano. A lot of the textile industries are discharging their effluents into the Chalawa River. And so if those activities are not controlled at that level of the environment, the human physicians cannot do anything about it, because you just see that the things will keep feeding. You will be busy. It's like you open a tap there, and then you keep cleaners here. They are mopping the floor, but the pipe is not repaired. You can't get any headway. So we want to bring everybody together, the veterinarians, the environmentalists, and the public health physicians, on this One Health platform.
Now, Prof, you talked about not making headway when you do not deal with the source of the problem. Would you want to say that lack of adequate professionals, so if you like, equipment to diagnose and manage some of these diseases is responsible for the level of fatality? He talked about Lassa fever and talked about the PCR and all of that, and how many facilities have it. Would you want to say that the level of fatalities is on that, the professionals in that field, and infrastructure, or if you like, equipment?
In a way, yes, but it is not the whole story. Because if you equip every hospital with the best equipment and human beings without controlling the source, you will still have this overwhelming thing. But in the way it is correct, I'll share my experience with you. In my center in Ebonyi, in 2005, our first wave of Lassa fever, nobody knew what it was then. We lost about 5 health workers. Very painful. So the Federal Ministry of Health came and we mounted the surveillance investigation, and eventually it was confirmed to be Lassa fever. Now, because of how it swept across our center, the next year, 2006, we had another case of Lassa fever. At that time, we didn't have the diagnostic capacity. We'll collect specimen and send to Irwa in Edo State. And then, even managing it, we didn't have the capacity. Then a lot of trainings took place, and health workers' capacity to diagnose and to manage was enhanced. But the fear that this thing, is fatal. Once you hear Lassa fever, many health workers run away. Because, number one, it is diagnosed late, and many people will die before it will be brought under control. But by 2015, 2016, the government in Ebonyi State then, realizing this problem, built and equipped the first molecular laboratory we had in Ebonyi State, and we were able to diagnose and confirm Lassa fever. Agencies like international agencies like Medicine Sans Frontier came to Ebonyi State, did massive training, especially in the area of infection prevention and control. Just what he talked about. Simple things like hand washing, wearing masks, the PPEs, and all of that. By the time the capacity of health workers were enhanced and were able to diagnose and confirm Lassa fever in our center, it is no longer a threat. In fact, these days people don't even know that Lassa fever has kept coming to the hospital. Many recovered because it was picked up on time, and the index of suspicion has been raised because of training and continuous training that has been going on in the place. So I agree with you in a lot of ways. Lack of proper equipment, and then low number of health workers who have the capacity to diagnose these things and to treat them raises the fatality rate. Something used to happen in our center before now. Lassa fever, for instance, will usually come in through the surgeons. There will be an emergency. Maybe a pregnant woman who is bleeding. And as a doctor, the first thing you want to do is save this woman alive. If possible, save the baby alive. Emergency cesarean section, you go to the theater and you operate. After the surgery, 3 days after that, all the health workers who participated in that surgery will come down one after the other. The doctor who operated may die. The nurse who assisted may die. And when that happens, it's like what terrorists do. They go after your security agents. And when they kill them, you, the ordinary citizen, become afraid. So once it picks up our health workers, the rest of the people become afraid. So, but with the training, with the equipment, with the general capacity of the entire system enhanced, that fear is gone. When a case arises, we know what to do now. The drugs are there. And in fact, when somebody comes in with fever, there are diagnostic criteria for Lassa fever, for instance. Throat pain, joint pains, abdominal pain, pains all over the body. When you start seeing bleeding from the orifices, it's already late. So once you start seeing this, you see somebody who has fever that has been treated for malaria, didn't recover, given a broad spectrum antibiotics, didn't recover. The next thing, if you are a well-trained doctor in Nigeria today, especially practicing in those areas where Lassa fever is endemic, the next thing you think about is Lassa fever or any of the viral exantemic diseases.
All right, let's put you on pause here, Prof, and quickly welcome Dr. Aisha Atahiru, who is a consultant public health physician and field epidemiologist. We welcome you to Good Morning Nigeria.
Thank you very much. Thank you.
Let's engage you right away. We've been talking about zoonotic diseases and all whatnot. Would you give us a sense of the usual modes of transmission of zoonotic diseases and how they can be reduced or mitigated?
Okay, thank you very much.
and I'm happy to be here in the midst of my senior colleagues and my mentors. So zoonosis zoonosis are diseases that are transmitted between humans and animals. So it can be both ways actually, but most of the time they are diseases that are transmitted from animals to human under natural conditions. That means not bioterrorism or something. Natural conditions, they can occur. And then there are different ways. First, direct contact with the animal. If you have direct contact with the animal, especially a sick animal or an animal that is infected, you can get it. Then through environment, respiratory conditions, respiratory droplets. Through breathing, you can breathe in some particles, aerosols that can infect the person. Then through intake of water, through the intake of food, like uncooked or poorly cooked meat, unpasteurized milk, that can cause bovine tuberculosis, eating maybe wildlife, some wildlife like bush meat, things, or rats that can predispose you to Lassa fever. These are some of the ways. Then human activities, agriculture, hunting, anything that will make you interact with wildlife, and even farming activities. These are ways that you can.
And how do we mitigate, the impact of these diseases?
The thing is, because
Once
of
we have
globalization,
failed to prevent,
yes.
once we have failed to prevent, how do we mitigate the damage that it can do?
Yes, because of globalization, it's very difficult for it to be controlled, because there will always be, there will be continuous interaction between humans and animals. People need to get source of income. They have to go out there. There's continuous agricultural processes going on. So these are things that you cannot easily say stop. However, you can mitigate, and let's look at it in the aspect of agent, host, and environment. The one that concerns us the most is the host, or the susceptible host. That's us. We are the ones at highest risk. So in that case, let's look at it at the individual level too. First thing, hand washing. Hand washing does magic, because once you wash your hands, you don't, many people rub their noses.
With what frequency, or at what rate, at what frequency?
As often as you can, but as often as you come in contact with things that you do not agree with. Like if you touch animals directly, especially sick animals like birds or dogs, you have to wash your hands. Before eating, after eating, after going to the toilet, after playing with your pets, just as often as you come in contact with things that are at risk, you have to have a high index of suspicion. When you come in contact with surfaces, some of these things hang on surfaces like the urine, feces. You have to wash your hands. Then you have to watch what you're eating. Cook your meals properly, especially meat. Meat carries a lot of diseases. We have the rats, Lassa fever. We have some of these foods that, even taking gari, because rats can pass feces in the food, raw vegetables, all these milk. You have to make sure you cook them properly. You have to make sure that you keep your environment clean. Very important. You have to block crevices, holes, to prevent maybe rodents and animals from coming into the house. Then vaccination. You can never underestimate vaccination. We have vaccines for rabies. We have for tuberculosis. Because even tuberculosis, there's the zoonotic part of it, bovine tuberculosis. So all these ones, they are very important. Then you have to be very healthy. Boost your immunity by taking healthy foods, vegetables, make sure they are clean. Personal hygiene, all these things. Some people go as far as maybe probiotics, anything, to boost your immunity. But basically with good food, water, then make sure you clean your water. Some of these droppings or infected materials fall into water. So you have to make sure that you take good water, you know, your water. Then on the aspect, on the part of the government, they should be able to provide clean source of water for people. Then continuous training of health workers, very, very important. And even the masses, how to prevent, because many people, not that they don't want to, but they don't know. If many people know the problem, the risk involved with taking bushmeat or handling bushmeat directly, it's a problem. Then in the health facility, the health workers should do standard basic precautions. Use of face masks, make sure they're washing their hands from one patient to another. That's the ideal, you know, to prevent any form of cross infection.
All right, thank you so much, Dr. Aisha Atahiru, for that. Dr. Shakir, I'd like to come back to you. You speak to us about the One Health approach you've been talking about. I know Professor has already mentioned it a bit, but of course you could expand on that. But also I want to ask, I'm just thinking, I asked you about the activities of man that affects, you know, this breeding of zoonotic diseases. Do you also suspect that it's possible that the interaction of man with these animals, because you mentioned that some of these diseases are in animals and they don't show symptoms or signs, is it possible that the activities of man with these animals leads to a transmission of certain things from man to these animals that eventually mutates, or if you like, breeds, and then comes back to man as zoonotic diseases? Do you foresee that kind of interaction?
Okay. So before I address that, I just wanted to quickly say something about one of the modes of transmission, you know, that we often forget. You know, sometimes zoonotic disease can be vector-borne, so we can actually get them through bites from ticks and mosquitoes. So when you talk about things like yellow fever, you know, it's a mosquito-borne zoonotic disease, and in many parts of the world there are other ones as well. So we also need to screen ourselves from mosquitoes, keep mosquitoes out of the house, have window screens, you know, where possible, sleep in a mosquito net, because you don't know which one is which. You have Aedes aegypti, you have Culex, you have Anopheles, and so on. So we have to be careful of our mosquitoes as well, because they transmit zoonotic diseases. So, so that one aside, then the issue of viruses crossing the species barrier to humans. So some of these viruses have been with the animals for thousands of years, so they've sort of adapted to the animals. They don't cause disease in the animals. So the animals now become like the reservoir. So they're adapted to live in those animals, but they are not adapted to live well in humans. So once they cross to the human side, it becomes a problem. Sometimes there's a strong inflammatory response from the human, which causes a lot of disease, or because they've not coexisted. The humans have not been in contact for a long time. It causes more damage in humans than it will have caused in animals. And so usually, as the virus is multiplying in animals, it's mutating. So it can mutate to such an effect that it becomes transmissible to humans. Not all of them are transmissible. Then sometimes, even when they're transmissible to humans, the rate of transmission is low. There was a time we were afraid of one flu outbreak. So when it happened, it died out within a short period of time because the rate of transmission was very low. It was highly pathogenic. It could kill, you know, a large number of people. Pathogenicity means if like 10 people get it, how many will die? We come down with severe disease. So if it's like 7 out of 10, that's very high. If it's like 2 out of 10, that's low, isn't it? So for that particular one, it was high, but the transmission rate was low. So there was no big outbreak. So the mutation that occurs in the viruses as they multiply can confer some properties to them that enable them to cause disease in humans. That's what happens.
So I was also trying to talk about the activities of man that could infect animals and eventually come back to us as zoonotic diseases.
That's possible, but I don't think it's a common thing that we think about. Those diseases are from the animals. So we've said about 60% diseases, infectious diseases that we have right now, are actually of animal origin. We've lived with animals for thousands, if not for hundreds of thousands of years. So we've had enough opportunity to get diseases from them. And they also transmit diseases among themselves as well. And rarely humans can also people have talked about humans infecting dogs with COVID, but that's not the usual. The thing is to cross from animals to humans. And because the viruses have been with them for a long time, they don't show anything. As you're sitting now, the number of germ cells in your body, bacterial cells, outnumber your own body cells. We have a lot of bacteria in our system. They are there, they've been there for a long time, and they have adapted to living peacefully with us. Some of them are actually useful in the production of vitamins that we need. They are useful in the digestion of food, and it's even more important in animals. Many animals can't digest their food without the bacteria. We have bacteria in our mouth. That's why if you keep your mouth shut for like 2 hours, you know, perfect environment, the bacteria will multiply and all sorts of things happen. So you can see we have bacteria within our guts that don't cause problems. But if you perform a surgery, and some of them cross into the open space in the abdomen, where you usually don't have bacteria, you have something called peritonitis and can lead to death. So bacteria can become stable, adapt to living in a particular without problems. But once they get elsewhere, it becomes a problem. So it's the same kind of thinking. In animals, no problem. You have bats with viruses. They are teeming with viruses, and they are healthy. But once those viruses get into humans, there's a problem because our biology is different from the biology of those animals.
All right. Thank you very much, Dr. Balogo. Let me bring Professor Bonaya in again. I'm just wondering, is there adequate collaboration and cooperation between the public health, veterinary, and wild sectors in managing these diseases?
The emerging and re-emerging infectious diseases has made it mandatory and compulsory, especially with the One Health approach to controlling these zoonotic diseases. Yes, now there is increasing collaboration, and everyone now knows that you can't do otherwise than collaborate. So there is, even at the national level now, in the Federal Ministry of Health, there's the One Health platform, and there's a framework developed which we are all following. When you know that these are the stages this thing passes through to get to human beings, why won't you collaborate? So we are collaborating better now, and especially in through our umbrella professional association, the Epidemiological Society of Nigeria. This is the professional association that brings together under one umbrella all these various subsectors of epidemiology. Those who are primarily of the veterinary origin, environmental, we have seroepidemiologists, we have even social epidemiologists, those who just study the human groups and see what is going on. There are some diseases you cannot get the head or tail of them until you employ the expertise of the social epidemiologists.
So if you have this collaboration, what then are the challenges in controlling and managing these infections? Why do we still have, why do they still go on rampage?
She talked about the human activities. The biggest problem within our problems are the human behaviors, the activities, and all of that. For instance, there is increasing urbanization. Man keeps getting to these animals where they are by urbanization. That simple act exposes us to the animals. Again, we don't have education at the optimal level we would want it. And surprisingly too, many even educated people, their health literacy is quite low. Take the issue of COVID, for instance. Many health workers did not believe in the COVID vaccine. Okay? You also talk about the infrastructure for healthcare delivery. We are still not there. The government needs to do a lot more than we are doing. our per capita health budget is very low in this country. Very, very abysmally low to actually take care of everybody. Our health insurance coverage abysmally low. So these are some of the things that prevent people from seeking health at the appropriate quarters when they are sick. We have a lot of, unfortunately, in our country, the regulation of orthodox medical practice is up, but the regulation of complementary medical practice is absent. A herbalist or a traditional medicine man can walk into the NTA and you give him all the airtime as far as he can pay, and he will claim what he does and what he cannot do, and they say all sorts of misinformation to the public that leads people astray. But a medical doctor cannot try it, even if NTA gives that person airtime. As he is walking out from your studio, his license is being withdrawn, because our ethics of practice does not permit advertisement. There are ways you can communicate your discovery. In fact, we don't publish our scientific research in newspapers. You present it at scientific fora. You are peer-reviewed, and if your peers don't agree with it, it goes nowhere. It goes nowhere.
Is that an advantage?
Yes, it is. It is an advantage, because otherwise, the capacity for human beings to do harm to each other is great. If you don't control, and especially with science that bamboozles the layman, if you don't control how it is communicated, people will just come out and claim what they cannot do.
Thank you so much, Prof. Let's quickly take a break now. When we come back, the conversation continues. Stay with us. All right, welcome back. It's still Good Morning Nigeria, live on the network service of the NTA. And our topic is on managing the prevalence of zoonotic diseases. Our guests are still very much with us, professionals in the field. And yes, they're talking to us about zoonotic diseases. We hear there's a conference, and we'd like to, get more perspective about that. So let's begin with you, Professor Ogbunaya. Tell us about the conference and what you intend to achieve.
The conference is our 11th scientific conference and annual general meeting of the Epidemiological Society of Nigeria, holding in this beautiful city of Abuja. We've been here since the 5th of this month. We had a pre-conference that featured on the training, the roles, and the challenges of the Nigerian Field Epidemiology and Laboratory Training Program, where that's a program that trains out field epidemiologists who are the actual foot soldiers, the foot soldiers that are mobilized anytime there is outbreak of any of these infectious diseases. So in this conference, we present scientific papers of researches that have been carried out in this area of zoonotic diseases, because that is our theme for this year. We also hold panel discussions where experts come and present topical issues around this theme, and we, at the end of the day, hold our annual general meeting where affairs of the profession is discussed. So that's what we have been since, we've been on since the 5th of June. Our conference will end today. This morning we are holding our second and third scientific sessions combined. We had an opening ceremony yesterday, attended to by dignitaries and stakeholders in the health sector, the Federal Minister of Health, the minister was represented, the WHO was there, the Nigerian NCDC was there, Nigerian Field Epidemiology training program was there.
You said this is your 13th, 11th conference,
Yes.
and your focus this year is on zoonotic diseases.
Yes.
Is that something professionals like you know that we do not know about zoonotic diseases at the moment?
Definitely. Many things that we know that we don't
Tell
know.
us.
All that we've been
Or
discussing.
is there an emerging zoonotic diseases that you're trying to...
There is always the fear of the next pandemic. In fact, it is said that the next pandemic of this zoonotic disease is just lurking around the corner. And we don't know when it will burst out. So we keep urging the country on what we call emergency preparedness and response. We should always be prepared. You asked a question the last time about why are we not continuing the testings and all the things at the point of entry. And he answered you very, very scientifically. But there are some of those mindsets that we must never drop. Like these issues of hand washing, these issues of if you are in a crowd, better put on a face mask. You don't know who is carrying what. And in the hospital setting, where it is the common route from where it gets into the general population, the hospital setting, every health worker is trained and encouraged to always maintain universal precaution. When you are dealing with patients, you wear your face mask. When it's necessary to put on your other personal protective equipment like aprons and gowns, you do so. And importantly too, we must communicate effectively to the general population and to our patients.
All right.
So,
thank you very much, Prof. Let me ask Dr. Shakir, the theme that you have chosen for this conference this year, how apt is it? Can you justify it given what we know with zoonotic diseases at the moment in Nigeria?
Yeah, sure. By the way, I actually gave the keynote speech during the conference, and these were the things.
So I have the best man.
So these were the things we talked about. And so zoonotic diseases will continue to increase because of the activities of humans. We are invading the ecosystems where these animals reside. So as populations are expanding, people are clearing new bushes, they're coming into more contact with these animals, and people are still, and poverty is another thing that is still there. People say Nigeria is the poverty capital of the world, and I think poverty has probably increased in Nigeria in the last 1 year. More people have been, dipped into poverty, and so it becomes a lot more difficult for people to, obey simple things that we tell them. You see, we talk about hand washing. A lot of people don't even have clean water to wash their hands, as simple as that is. Even some hospitals, I was in a teaching hospital, we did a procedure to wash your hand at the wash hand basin, the water was not flowing. Something as basic as hand washing we are still struggling with. So we get the sense that we are not doing enough to prevent and control zoonotic diseases. We need to create more awareness among medical professionals. We need to increase the collaboration, and that's why one of the things we talked about is how to increase the collaboration between the different professions. And Prof mentioned some of the things that have happened in places like NCDC, where there's a technical working group for One Health that brings people from all sectors and disciplines together. And now we have a high-level steering committee at the ministerial level to give One Health issues more visibility, more advocacy, and hopefully more funding and more support for things to happen.
I just thought about this now, Professor Shakur. Dr. Shakur, do you foresee that zoonotic diseases may eventually die down? You talked about the fact that human activities, clearing the bushes, and more animals are going into extinction. So, is there a likelihood that in the near future, zoonotic diseases will also come down?
You know, zoonotic diseases don't come just from wild animals. They also come from domestic animals as well. So a lot of, you know, people talk about, when we talk about zoonotic disease, people think viruses, but we get a lot of bacterial zoonoses as well. He talked about cattle getting, you know, cows are not about to be extinct. Then we get salmonellosis as well from poultry, from eggs. People take raw eggs or improperly cooked eggs. You can have salmonellosis from those. You can have that from improperly cooked poultry.
Are you saying that some people prescribe
So when we say salmonellosis,
raw eggs? Are you saying that's not good?
there's a risk of getting salmonellosis. When we say salmonellosis, we're talking about bacteria causing enteric fever, things like typhoid, enteric fever, and the rest of that. So we can have those as well. So we have, apart from the viruses that we're always thinking about, Lassa fever, Marburg, Ebola, you have bacterial zoonosis as well. And those things have nothing to do with wild animals. They're animals that we keep in our houses, in our backyard, that people keep in their farms and so on. So the processes of food production, animal food production, plant, you know, bring about scenarios that increase the likelihood of zoonotic transmissions happening. And the other bit that people forget, you can get zoonosis from vegetables as well. It's not always about meat. When feces from animals, you know, contaminates vegetables and you don't cook properly. And if you look around, you see a lot of people that, you know, farm vegetables, they use manure from animals, and that is a source of contamination. So we have to pay a lot of attention to cleaning the vegetables. Otherwise, you can easily get zoonotic bacterial infections and even parasitic infections from animals.
Okay. Dr. Tahiru, I just want to ask, what's in this conference for those who are attending, professionals, and maybe if you have guests, what are they likely to benefit from this?
Okay. This conference has brought together professionals from different fields, from different approaches to solving the problem we have at hand. We have the zoonosis. So first, it brings people together. So you have that networking, which is very important. You can work on things together. You have your ideas, you have your ideas, I have my ideas. Then we can collaborate. So it's an important avenue for collaboration. Then it also invokes thought process. Because when I listen to your study and I'm like, oh, this is an aspect. Why don't I try that in my area? Why don't I even find out? Then why don't I give some interventions? Some studies have limitations. That means the aspects they were not able to touch or some of the hindrances they had. You can develop your own strategies, you know. It also facilitates leadership. You know, I was in the LOC, the scientific committee. So it gives you this, it brings you to meet with people, you know, even work with the younger ones, work with the older ones, and then you see how they are doing, the senior ones, you see their patterns of leadership, what has been working for them, and then you can also develop your own pattern. So it has done a lot. You know, I wouldn't have been able to see him. We've been talking on phone, Zoom, you know, but when I saw him, you know, it's an avenue that many people don't have.
All right, so you're a professional, Dr. Tahiru, and you're talking about the benefits to you. What's the benefit to the general public? Those.
At the end of this conference, we are going to release a communique. That communique will address individuals, it will address communities, it will address governments, it will address the entire system. We profile solutions, and we are in an advisory capacity to assist government to do what it ought to do to mitigate the impact of this. When we also listen to the researches that have been done, and we pass it across to the wider community. It enhances public health and safety, because that is our ultimate goal for this. So it will increase the level of knowledge of the general population about these zoonotic diseases. It will increase the capacity of the health system to deal with the zoonotic diseases. It will increase the capacity of policymakers to refine our policies or to develop new ones to controlling these zoonotic diseases.
You said the conference started on the 5th.
Yes.
When is it likely to end? And then are members of the public invited to the other sections you're likely going to have?
Yeah, it will end today with our dinner. And let me use this opportunity to invite you all to the dinner that will happen at the National Center for Women Development from 6 p.m. today.
All right. Thank you, Prof. I'll take the invitation very seriously. Doctor,
Basically because dinner is involved.
Yes. I'm not a health practitioner.
NTA has been around to cover.
Yes.
Exactly.
But we've not dined. We're coming to
No
dine
problem.
today.
You are invited.
Give us a sense of what the take-home could be for government agencies like the NCDC, for instance. And what is your reading of their reception of the ideas that you get from the conference?
Well, NCDC is part and parcel of all the things we're doing. So there is hardly anything we do from my own perspective, AFNet, that NCDC is not involved. We support government. They take the leadership. And I was talking about technical working group for One Health. It's right there at NCDC. So NCDC leads the process technically. They bring all of us together, so we contribute. So it's a platform that is led by NCDC. So NCDC, there's nothing we are going to preach to NCDC. NCDC is the champion for One Health in Nigeria.
And what do you expect to see? Because what are the outcomes that you expect to see arising from this conference?
Of course, you have people coming from all over the place, epidemiologists, other physicians, I think it's going to increase the evidence base that NCDC has in designing interventions. So each time somebody does a study and publishes a result, it adds something to the evidence base, and I'm sure NCDC is going to pay attention to that. And since we're coming to the end of this, I just wanted to say something about something we are doing at AFNet involving journalists, something called the Media EIS. I don't know whether you've heard about it. So it's Media EIS, E for epidemiology, I for infodemiology, and S for social and behavioral risk communication. So we have a fellowship where we train journalists on health matters for 9 months, and they are mentored. And one of the areas they work on is zoonosis. They have other things, but zoonosis is one of the things they work on. And this week we are having the final, workshop for the fellowship. So we brought in people from TV, from newspaper, all the different, media, platforms, and we've built their capacity in epidemiology to understand the key terms and epidemiologic thinking, and also infodemiology, the dynamics of information creation and transmission, and how that can affect misinformation, disinformation, and the rest of that. Then also how they can help in communicating risk to people, because journalists can act as message amplifiers. TV, newspaper, we create the messages, but journalists have a better way of speaking in a language that people understand. So it's something well sought after. Hundreds of people applied for it, but we had a small group at the end of the day.
Dr. Serger, I can feel that you enjoy, this aspect of medical science.
Which aspect?
Zoonotic diseases.
Yeah, it's one of those things that I enjoy.
What is the challenge for you? One major challenge you think that everyone in this field is currently facing?
The major challenge. Well, I think to deal with biological agents generally, viruses, bacteria, and the rest of that, you need a lot of laboratory infrastructure. We have made some progress in the last 10 years, but I think we still need to expand our laboratory capacity, our ability to deal with pathogens. I mean, germs like bacteria, viruses, and the rest of that. So that's one major area. When it comes to collecting data analysis, all those things, they are not issues, but the infrastructure, the network that we need. The laboratory network is one area. NCDC has done a lot and built the capacity of some labs in Nigeria, since NCDC came on board in recent years, but we still need to be able to do a lot in terms of laboratory diagnosis.
All right.
Yeah.
Thank you so much, Dr. Atahiru. I'd like you to speak to us, as a woman in this field.
Okay.
Talk to us about the challenges, and then
Are
what
there
would
disadvantages peculiar to
a woman practicing it?
Actually, for me, it's been great because the passion has to be there. So once you have the passion, whether you're a male or a female, it goes a long way. Then you have to tell yourself that you have to prove yourself. You have to create a niche for yourself as a female. And then you have to show that whatever your male colleagues are doing, you can do it.
Better.
So you have to double up. You have to carry the whole front with you, and you yourself, you have to be mentally, physically, and psychologically prepared.
What would be your message to a young girl, watching you at this point, who may want to go into this field, epidemiology?
It's an excellent area, and you will do splendid, and you will do very well. You don't have any problem. There's nothing. What they can do, you can do. We're all at risk of diseases. We're all at risk of coming in contact with things we don't want, and then we all have the leverage to be great. So if everybody can be great, you're a female, you're a human, so you can do it.
All right. As a round off, I just want to take you away from the whole zoonotic diseases thing. Dr. Sergey, you've been practicing in Nigeria. What have you not thought about JACBA? And then what's your advice to other doctors who think that it's better, the grass is greener elsewhere?
Well, I don't discourage people from leaving the country. People leave for many reasons. For personal development, there are more opportunities obviously out there. And the thing is, I have a lot of friends who have left the country, and they're also paying back to the system. We have friends that come around and organize outreaches and provide free surgical and medical care. We have doctors that mentor researchers in our universities. They work together, they get grants, and they do a lot of work. If they had stayed back in Nigeria, they probably would not have been able to do that. So I don't discourage people leaving. They leave for many reasons, but what we need to do is to try and hold on to people as much as possible. So there are push and pull factors. The pull factors, there's nothing you can do about them. They will always be pulled. Doctors leave the UK for the United States because there are better opportunities in the US than Nigerian doctors move to the UK. So it's for us to create a better opportunities for Nigerian doctors to remain. Most doctors would actually prefer to remain. There are people that went and came back. There are people that stayed back, to continue to work in the system. I know a lot of people would prefer to stay back in Nigeria if the opportunities for career. People always think about money. It's not always about money. Yes, money is important to take care of yourself and your family, but opportunities for career development. You have people working in the Nigerian system, they don't have the equipment they need. Sometimes people get trained in the UK and India and other places and come back, and the equipment is not there in the teaching hospital. They can't do what they have to do to help people. So those things are the things we need to focus on. We need to be able to provide the opportunities for career development, of course improve the salaries of people. Then the broader thing is to think of how to finance the healthcare system. It's at the bottom of everything.
All right.
Healthcare is expensive everywhere in the world. There is a cost. How are we going to meet the cost? That is the question we need to answer. Once we're able to answer that, and we're able to provide the resources, I'm sure more people will stay back and work in the system.
All right.
People want to give back to their society.
Yeah.
So we would like to stay back.
Okay. Dr. Aisha Atahiru, consultant, public health physician, and field epidemiologist. We thank you very much for your time on the program. All right, Dr. Mohammed Shakir Balogo, resident advisor, African Field Epidemiology Network, AFENET. It's been a pleasure having you on the program this morning.
Thank you for having me.
And many thanks to Professor Lawrence Ogbonnaya, President, Epidemiological Society of Nigeria, EPICEN. Thank you very much for your time and your thoughts on Good Morning Nigeria.
Thank you for having me.
Yeah, I'm sure when I have you some other time, I would like to ask why doctors go on strike when labor calls for strike. All right, so that's our package. And good morning, Nigeria, this Friday. Many thanks for watching. Have a great weekend. I'm Henry John.
All right, I'm Victor Azu. Enjoy your weekend and see you on Monday.